chronic diseases which are established already and are seen by a doctor earlier, the patient can directly interact with the doctors, sending the blood sugar report, or doing the ECG at home there are many devices now you can transmit your ECG. And I personally feel there should not be any problem if you do this exchange of business at different hierarchies. And that happen, let some complaint happen, then the law will form. But as usual, of course, the government is in process, it will take some time. But your questions was very specific and there is no answer to it as of now. My colleagues.
I think I'd like to just return that question in the sense that it was once said to me by a 15-year-old girl who said to me, and this is a direct quote, "Sorry, I actually need to go and see a doctor to do that." The point is that most of us in this room here are, I'm looking around, probably over 30. But we're not talking about our generation. We're talking about, for many of what we're talking about is the generation who are children. Our 15-year-olds, our 18-year-olds, our 12-year-olds. I know people who can, kids, 2, 3, 4, who can use an iPad much better than I ever could. But the point is, they are used to technology. We find change difficult. It is us that have got to change to adapt to how they live their lives. That doesn't mean we should have no safety net, but why is it, and I ask the question, why is it that a 15-year-old girl, a 16-year-old, 17, 18-year-old girl shouldn't be allowed to obtain contraceptive pill, for instance, or her migraine medication, or her asthma medication over the internet, as long as the safeguards of her regular checkups are taken? Why should she have to go and waste time getting a bus, going to her primary care centre? She shouldn't. She can buy a car, she can buy her groceries, she can buy her books, all online. Why is healthcare not just an extension of that? As long as we ensure that the safeguards that are necessary to prevent the risks that I talked about have been put in place. After all, we shouldn't harm patients with healthcare IT, but if we can make their lives better and our lives better, then that's the right way for healthcare IT to go.
I'd like to add, all this is indeed extremely interesting, but politicians, will only come when the whole thing is in place. They will wait till, and I think what you mentioned is exactly what is happening around the world. So let's not wait for that. There are legal issues that have been addressed. France, for example, has now a very clear definition of the rights in the position of telemedicine acts and for doctors as well. So it is on the move, but it's not the most important thing. I'm convinced myself, as a citizen, as a potential patient, that there are far more medical accidents happening already in the traditional way than there are, in fact, in telemedicine. And it's not only a matter of the healthcare professionals. What about it if a device goes wrong because electricity is not there, God knows what. You can imagine all sorts of things. And if I may add, and still with all due respect, I hope one thing, that in this field of e-health, the lawyers will not start taking over. Because when that starts, we end with a situation like in the United States. And again, with all due respect, when the lawyers are going to try to sue for whatever, and that's not what we want, do we?
I mean, all of you and you have stated very nicely. And I feel that, if the stakeholders are happy, we'll go ahead and do business. And you see, as I told you, every second some exchange informations are going on using your handphone. This has ever happened when the mobile handset has occurred. Of course, previously we had telephone, all this is going on. It is just taking that process a little bit more in a next step. Otherwise, the telemedicine was there earlier also, when you used to send a fax and talk to your friend, please tell me what it is. So we are doing it more sophisticated and implementing more gadgets and technologies. So I think go ahead and do whatever exchanges you can do it, as far as there is your comfortable position at both the ends.
If I may add one little comment to your presentation, Colin. Again, we need vision for the future. We need change. The change is going to happen. But unfortunately, time is the only thing you cannot buy or sell. That doesn't mean sit down and wait. But it means allow also time to contribute to mature things. Because it's so exciting. We all want it being done overnight. It is all relative, believe me. It will happen one way or the other. There are two pieces of good news. First of all, there's no way back. And secondly, the future is not like that. It's like that. Meaning, the more we go, the broader the scope, the more there will be done. And the next generations will not be without any work related to telemedicine or e-health.
Just one last question or comment from lady over there. Yeah, yourself.
Very good morning, sir. I'm a student from ASCII. My name is Leela. I wanted to ask a question to Mr. Gavin. You mentioned a very interesting solution about smoking, anti-smoking solution. I'm sure India also needs it very much as does New Zealand does. I wanted to know how far has it worked and how has it worked in New Zealand, considering the...
And so they will be in a wider program usually. They may be using patches, they may be using other forms to quit smoking. So this is a system that just helps remind them and keeps it, tries to keep them on track towards not smoking. So it's a system that's used in combination with others. Okay,
I just wanted to point out much.
Okay, with that, we'll close the session. So I join Frank to give thanks to the speakers in this session. I thanks all the discussants and all the participants in this session. So we'll break for coffee after that. I think the organizers may take over. Thank you again, and for the good morning.
And speakers, ladies and gentlemen, this brings us to the end of session 1 that we have lined up for everybody today is tea, which is happening from 10:30 to 10:45. And keeping in mind technology, the next session is from New Delhi and it starts precisely at 10:45. So I request all of you to please be in your seats at 10:43 a.m. sharp, and tea is being served in the adjacent room. So please go ahead and help yourselves. And at the same time, we also have the trade exhibition happening in the adjacent room where the tea is being served. So feel free to have a look. Thank you so much, and we'll see you here at 10:43.
It's truly wonderful that you could spare time. We really wish that your physical presence would have been wonderful, but we are glad you are there.
Well, thank you. I think this is a case of showcasing IT.
No, I think they have done a good job bringing various international players and also connected to virtual connectivity to 33 countries. So I think things are happening. What we need is to crystallize and this go, how do we go? And I think we need your direction there. How do we make it happen? And give this benefit to people.
Sure, sir. I think Apollo is taking a major role and effort in really making healthcare system more affordable and accessible, and IT is a tool.
Yes.
We thank you for this initiative.
No, sir, I think we strongly believe that there is something that we can make and make a difference and quickly alleviate the great apprehensions the nations have. Nations have on their personal health and health care. I think all of these, this could be one of the great tools.
Sure, it's technology has to serve a need, and tools then become relevant in the context in which they get used.
Yeah. And we're grateful, sir. We'll start in 2 minutes.
Sure.
Thank you.
Oh, 2 minutes for everybody.
Next session As you're aware, the Parliament is in session now and our important secretaries could not leave Delhi. But we truly appreciate the fact that you are spending time with us via video conferencing. I think it's most appropriate in an IT conference to use technology to bring you closer to us. Good morning, Mr. Ramaswamy. It is truly a pleasure to have you here with us today.
Good morning.
You have an audience of over 500 people in this room, but you're also being followed on the web by about 300 people from 30 different countries. The entire program is being live webcast, and I think the number of people who are interested in the concept and the transformational capability of IT in healthcare is growing every day by the minute. I'd like to welcome the entire audience to this exciting session. The session has really been entitled The Indian Perspective, A View from the Top. And we have with us three very important secretaries from the government to share different views. It is my honor and privilege to first introduce Mr. Ramaswamy. He's currently Secretary to the Government of India, Department of Science and Technology. He holds a master's degree from the University of Madras, India, and a PhD from the University of Leeds, UK.